Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS Navigators are online throughout today's program, answering questions and connecting you to resources. Multiple sclerosis is an unpredictable disease that can impact every aspect of life. That's why it's so important for people affected by MS to understand their health insurance options and to make sure that they stay insured, even when their circumstances may change. Joining us today to help us understand options that will help keep healthcare plans as affordable as possible is Carla Turechek. Carla is on the National MS Society's MS Navigator team, where she specializes in health insurance resources. Welcome, Carla. Thanks for being with us today.
Hi, thanks so much for having me, John.
I find it's always a good idea to start with the basics. So, can you tell us what the main sources of health insurance are?
Sure. So, health insurance can come from private and public sources. Private insurance would include group health insurance, and that is insurance that's offered by an employer or an employee organization, such as a union. And private insurance also includes plans that are purchased on the individual market, including the health insurance marketplace. And you might know the marketplace as the website healthcare.gov. Public sources of insurance, on the other hand, that refers to government programs such as Medicare, Medicaid, and Veterans Affairs benefits.
Well, we've heard from Carl, who says he finds health insurance very confusing and doesn't know where to start. Are there resources that can help Carl understand the types of coverage he may be eligible for?
Yes, there absolutely are. And I don't blame Carl. Health insurance can be so confusing and it can be really overwhelming. My team at the National MS Society created a guide. We call it the Finding Coverage Guide. And it's on the Society's website, and it can walk Carl and others through their health insurance options. So, a nice, quick, and easy way to find it is by going to nationalmssociety.org/get covered. It's a guide that kind of takes you from the very beginning. It shows you where to start. It kind of walks you through all possible ways to get health insurance coverage. It tells you what to look at step by step. But I know too that sometimes people will read the guide and they still need help. You might still feel confused. A lot of people too just kind of prefer to talk through everything with a human, but we can do that as well. So you can always contact an MS Navigator and somebody is able to help walk you through what your health insurance options would be.
And what should people living with MS consider when they're choosing a health plan?
There are so many different things that people should consider. And a question that I hear often is, how do I decide on a plan? How do I pick something that I need next year when I don't know what's going to happen next year? I don't know what might happen with my MS. And it's a great question. You can't know with 100% certainty what you're going to need in a plan. But what you can do is to try to estimate. Think about what your current healthcare needs are. Think about what you did this year. And then that can kind of inform you on what you might need next year. So go over what happened this year. Make a list of all the doctors that you see. Think about how many doctor visits you had. Were you hospitalized often? Did you go to the emergency room? Is that something that you tend to do often? Has your neurologist mentioned that you're going to need any testing like MRIs? Those are all good things to think about. And look at the costs as well when you're looking at plans. Of course, that's so important. So think about if you have to have a hospital stay, what would your plan cover? What would you be required to pay out of pocket? Primary care and specialist visits, what does that look like? What would you have to pay for those? Speaking of that, too, the primary care and specialist visits, it's so important to think about your access to providers and to think about networks. You have to look at, are your doctors in the plan's network? What about your preferred hospitals, pharmacies, facilities, anything that you prefer to use? Can you still go to those places with this plan? Does the plan require a referral from your primary care doctor before you can see a neurologist? Prescription medications, that's important too to think about. So each plan has a formulary, which is basically just a list of the prescription medications that that plan covers. So think about, are your medications on that plan's formulary? The formularies are often divided into tiers, which is basically different levels of coverage with different out-of-pocket costs. So that's something to think about too. Which tier are your medications on? What can you generally expect to pay whenever you fill your medication? So clearly there's a lot of different things to think about. And the Society's website has some worksheets and some guides that list all of these points and more. And there's some space for you to make notes on it too, so that you can make sure you're focusing on the things that are most important to you.
Chase tells us he's wondering if MS is considered a pre-existing condition. And if it is, can an insurance company refuse to cover him?
So, a pre-existing condition is defined as any health condition that exists before a person enrolls in a new health insurance policy. So, MS can be considered a pre-existing condition. Lots of different things are. Before the Affordable Care Act became law in 2010, health insurance companies often denied coverage to people with MS or even charged them significantly more just because they had a pre-existing condition. But that's not the case anymore. Health insurance companies are not able to refuse coverage or charge you more just because you have a pre-existing condition. Now, there can be one exception to that. If a person still has a health insurance plan that they purchased before March of 2010, then that plan might be considered a grandfathered plan. And those plans may not include all of the Affordable Care Act's protections, so they don't have to cover pre-existing conditions. If you do have a grandfathered plan, though, that plan is required to tell you that it's grandfathered, so it shouldn't be a surprise. And it may not even be something that's that common anymore, but it's a possibility.
Daniel says he's not covered by his parents' health insurance plan anymore. So now he's responsible for figuring out his own coverage. And Daniel wants to know the difference between a premium, a deductible, and a copayment.
Sure, this is so important to know. So the premium, that is the amount that you pay to your insurance company every month just to have your plan, just to stay enrolled in your plan. A deductible is the amount that you have to pay for covered health services before your plan begins to pay for things except for free preventive services. And with deductibles, it's important to check with your specific plan for the details on how that works. But generally, after you meet your deductible, you then will share the cost of covered services with your insurance company. And a copayment is your responsibility for the service. So the way that it might work is your insurance company will pay their portion for a service, and then there's a portion left over for you to pay. And that portion that you pay is either going to be a copayment or a coinsurance. A copayment is a fixed amount. So for example, Your plan says every time you see a neurologist, you will pay a $40 copay. If it's a coinsurance, that would be a percentage. So an example of that would be whenever you go to the neurologist, your plan covers 80%, let's say, and then you are charged a 20% coinsurance.
Jody says he doesn't work and his husband's health coverage through his employer is very expensive. Now, Jody's doctor suggested he sign up for Medicare or Medicaid, but he's been told that he's not eligible for either. First, can you tell us the difference between Medicare and Medicaid?
Yes. So their names sound so similar, and it can be easy to mix them up. Medicare is the federal government program, and it provides health insurance for people age 65 and older. But people under 65 may be eligible for Medicare if they have a disability or if they are diagnosed with ALS or end-stage renal disease. Now, Medicaid, on the other hand, that is more of a state program. Each state operates its own Medicaid program according to federal guidelines. And Medicaid provides health coverage for eligible low-income adults, children, elderly adults, and people with disabilities.
So, getting back to Jody's situation, how can someone living with MS not be eligible for Medicare or Medicaid? And as an important follow-up, what are Jody's options?
Yeah, so just having the diagnosis of MS does not make a person eligible for Medicare or Medicaid. There is more to it. With Medicare, to be able to get Medicare, if you aren't yet 65 years old, then a person with MS would have to be receiving Social Security disability benefits for about 2 years. And with Medicaid, there are financial eligibility guidelines that a person has to meet. So your income must be low enough, and there can be asset limits as well. And also, depending on the state, the disability determination from Social Security, sometimes that's required as well to get Medicaid. And Jody's options, so he already knows that he can't get Medicare or Medicaid, and it sounds like it might be too expensive for them to add somebody to his husband's coverage. So what Jody can do is look into purchasing a plan for himself from the marketplace. And what I would advise them to do is to compare the costs. So he can look at the marketplace plans and determine what would this cost to purchase one of those plans and compare that to the cost of adding Jody to his husband's insurance to see which one might be more affordable.
Where can people learn more about the eligibility criteria for Medicare and for Medicaid?
So going straight to the source, that is one way to do it. Talking directly with Medicare and Medicaid or looking at their websites, sometimes that can answer some questions about eligibility. And this is really important for Medicaid, especially because the financial eligibility guidelines for Medicaid can be different from state to state. But the National MS Society is here too, and MS Navigators can help you find that information and can help with answering some questions.
We heard from Emma, who told us she's a college student. And Emma's wondering what type of health insurance options she might have.
Yeah, so Emma does have a few options. One thing that she can do is to check with her school. A lot of colleges and universities offer student health insurance plans for their students who need coverage. So if her school does offer something, the school can tell her how much the plan costs and also what benefits it would include. And another option is purchasing a plan for herself from the marketplace. It's the same marketplace we just talked about with Jody. But a third option that she also might have depends on her age. If Emma is under 26, then her parents' health insurance might be an option if they have coverage. So if you have a parent who has health insurance and if the parent's plan covers dependents, you often can be added to their plan and stay on it until you turn 26. And this can apply to job-based group plans but it can also apply to marketplace plans too if her parent has one. So Emma does have a few things that she can look into.
Leanne told us that her employer offers many different options for health plans every year. And it's really important to Leanne that she keeps her doctor. What can she do to make sure that happens?
Yeah, when you find a really good doctor, you do not want to let them go. I understand that. So it's so important to be aware of networks. So a network refers to the doctors, hospitals, and other facilities that have a contract with your health insurance plan to provide medical care. So if Leanne has a list of the plans that her employer offers, she can ask her doctor's office if they accept any of those plans, but she can also check directly with the plans too. Most insurance companies will publish their network information on their plan websites, but you can also call the plan and you can ask them if your doctor is in the plan's network. And it's also a good idea to pay attention to the types of plans that are being offered, such as an HMO or a PPO plan. HMO stands for Health Maintenance Organization, and they only cover care from doctors who are in that plan's network. PPO, on the other hand, that stands for Preferred Provider Organization. And those premiums are usually a little bit higher in exchange for more flexibility with providers. You'll get the most coverage from your PPO when you are seeing an in-network doctor, but the plan will provide at least a little bit of coverage if you go outside of network. So this is really good to be aware of if you see a lot of doctors and if you can't find one plan that has all of them in network.
Angel says he's covered under his wife's employer's insurance, but Angel's wife is retiring in a few months. Angel's very concerned about being able to afford his MS medications, and he's wondering what options he'll have when his wife's coverage ends.
So I wonder if Angel's wife will be starting Medicare. If that's the case, then her Medicare is only going to cover her. So Angel definitely does need to check out his own options. And I would encourage him to start by contacting the marketplace. So when you contact the marketplace, they have you fill out an application, and the application is to see if you qualify for savings on a plan, but it also will screen you for Medicaid eligibility. It tells you if it kind of looks like, based on the income information you provided, if it looks like you might qualify for Medicaid. So Angel can explore marketplace plans to see if there's an option that would work for him, hopefully something that covers his MS medication. And that, by the way, that is a valid concern, that the medication costs. So if Angel finds a plan that covers his medication, but his out-of-pocket cost is too high, the manufacturer of his medication might offer copay assistance. But also, if he happens to find himself without coverage for a period of time, he can also talk to the manufacturer about that and ask, do you have a program, something that can help me to make sure I stay on my treatment while I'm uninsured? Depending on the type of insurance that somebody has, there can be lots of different resources to check on for help with prescriptions. And we have a guide for that as well that we at the MS Society created. It's kind of similar to the guide I mentioned earlier, that Get Covered guide. But this is a guide to prescription financial assistance that you can use to make sure that no resources are missed. And to go to that, you would go to nationalmssociety.org/RX help to look at that guide.
We heard from Diane, and she's got a little bit of a quandary. Diane tells us she lost her job, so she tried to apply for Medicaid, and she learned she must be disabled in order to be approved, as you explained to us just a few minutes ago. So even though Diane is currently unemployed, she doesn't want to stop working permanently. Is there another way for Diane to get health insurance?
Yeah, yep, there can be some other ways that she can look at. So, one thing she can try, if Diane lost her health insurance within the last 60 days, she could continue that coverage by electing COBRA. So COBRA is a law that gives workers and their families who lose health benefits the right to continue group health benefits for limited periods of time under certain circumstances, like job loss and some other qualifying conditions. Qualifying events. So Diane should receive notice from her health insurance company in the mail, letting her know if COBRA is an option and how to proceed with it if it is an option. But COBRA can be quite expensive. That premium that you'd have to pay for COBRA, it usually will include the portion paid by employees, plus the portion that the employer was paying for you, plus a 2% administrative fee. So that does tend to be a lot of money. So Diane can also look at the marketplace to explore plans and to see if there might be something that's more affordable that would still meet her needs. But let's say too, because I hear Diane saying that she doesn't want to stop working. She wants to continue to work. So let's say that she finds a new job after a little while, and that job offers health insurance. That's great. And Diane can disenroll from her COBRA coverage if she takes COBRA, or she can disenroll from her marketplace plan so that she's able to join the new plan that her new employer offers.
Well, we heard from Raina, who has tried to find coverage that she can afford, but she hasn't been successful. And Raina's wondering if others are facing the same type of financial challenge that she is and wants to know what she can do about it.
Yes, so many people have this challenge, unfortunately. And as we've been talking, John, we've talked about so many different types of health insurance coverage, but it happens. Sometimes there just is not an affordable option for somebody. So in this case, in Raina's case, there's a few things that she can do to try to make care without insurance as affordable as possible. So one thing is that she can ask her neurologist or any other doctors that she sees. She can ask if they offer anything that would lower their fees for uninsured patients. And if she needs hospital care, she can look for a hospital called a safety net hospital. Those are hospitals that might provide lower cost or even free emergency care to people who don't have insurance. A health center is another resource that she can look at. So, a health center provides affordable and accessible primary healthcare services. It is usually primary care, though. They do not typically offer neurology services, but they can sometimes help connect people to specialists in the community for lower cost care. And also, if she takes prescription medications, she can check with the manufacturers of her medications for any assistance programs that they might offer, but also drug discount cards and discount pharmacies. Those can be great resources sometimes. They can be helpful to explore to see if you can find your medications for a much lower cost without having to use health insurance. And all of those points to explore, those are all listed on our Finding Coverage guide at nationalmssociety.org/get-covered, because we know, unfortunately, it still happens that sometimes people just can't find an affordable way to get health insurance.
Well, Eric tells us that he has employer-based health insurance and he wants to know how to keep his costs as low as possible.
Yes, so it is so important to know your coverage and to know your rights. Healthcare, it can be expensive even when somebody has health insurance, but if you know how your specific plan works, that can really help to keep costs down as much as possible. So check that your provider is still in your plan's network before your appointment. If you have an upcoming appointment that you know about, check ahead of time just to make sure. When your insurance company sends you paperwork, like if you receive an explanation of benefits about a recent visit that you had, or any other letters about plan changes, keep those, review those. And also, if your plan denies coverage for a treatment or a service or anything that you and your doctor believe is really medically necessary for you, remember that you have the right to appeal that denial. your plan can tell you what that process would look like. So they can tell you how to start the appeal. And then you can work with your medical team to put together the documentation that shows why that service should be covered for you or why that specific treatment is medically necessary. So there are a few things you can look at to try to make costs as low as possible.
Paul has MS and he recently experienced a bad relapse. Now, Paul needed to go to urgent care, but he was worried about the cost because he doesn't have health insurance. And Paul wants to know what he can expect to be charged for a doctor's visit without insurance and what happens if he can't pay that bill.
So what Paul is going to be charged for the visit, it really just depends on the provider that he goes to and what those fees are. But the urgent care provider may offer something that can help to make care more affordable for patients who don't have health insurance. So maybe they use a sliding scale where they would adjust their fees based on somebody's income. Or maybe they offer some type of financial assistance program. And there's a few terms or names that they might have for something like this. So they might call it indigent care, they might call it charity care. So those are some things that they might talk with him about ahead of time, or Paul can just directly ask if something like that is offered. And if he does receive a bill that he can't pay, the first thing that I think he should do is to check it over to make sure that the charges look correct. And if he has any questions about anything on there, he can call the provider's billing department to get more information. He can also ask if he can set up a payment plan so that hopefully he can make payments that are a little bit more manageable with his budget. And he can even attempt to negotiate the bill to try to get the cost lowered. So it is possible to do this. And I know there's a lot of people like me, like I kind of feel this way. I don't know that I would feel comfortable trying to negotiate medical bills, but there are resources out there that can help people understand how to do that and to give tips on negotiation. The Patient Advocate Foundation is one really great resource that has a lot of tips to help people with negotiating medical debt.
You know, during our conversation, you've reminded us how helpful MS Navigators can be. So how does someone reach an MS Navigator to get some help with this topic, as well as all the other things you guys are so great at supporting?
Yeah, so you can call an MS Navigator at the Society's phone number, which is 1-800-344-4867. You can also send us an email at contactusnmss@nmss.org. But we also have online chat at our website, nationalmssociety.org. You can chat directly with an MS Navigator right on our website. There's a few ways to reach us.
Well, thanks so much for sharing your expertise with us, Carla. I just want to thank everyone who submitted really great questions today. And again, thank you for all the great information you shared today.
Thank you. Thanks so much for having me.
Before we close, I want to remind you that for information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups. You'll hear about ways to get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Carla for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSExpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. On YouTube, you'll find that link in the program description. And on Twitch, you can find that link in the chat. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Carla Turechek and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.